painful. However, these fractures usually heal themselves if proper rest is taken for appropriate duration, which may be up to 2 months. Usually, these fractures occur in leg bones. Management of stress fracture. First of all, elevate the extremity and rest while bone heals itself. Apply ice to the affected area for 24 to 48 hours. If pain persists, give some painkiller. If there is any need for immobilization of any of the affected area, use a splint. After the removal of swelling, begin to put partial weight on the affected area. Crutches or walking stick may be used in the beginning. After 2 weeks, start putting normal weight. For 6 to 8 weeks, avoid the activity that caused the stress fracture. Then start doing activities slowly. Green stick fracture. A green stick fracture is that fracture when the bone bends or cracks instead of breaking completely into separate pieces. This type of fracture usually occurs in children because their bones are soft and more flexible than bones of adults. Management of green stick fracture. Most of these fractures involve arms and legs, which require immobilization to make the bone grow back together in proper or natural position. A removable splint is the most recommended among children. Swelling that occurred at the site of fracture may be reduced with anti-inflammatory drugs. Pain can be relieved by taking pain relievers. Generally, it takes 8 weeks for complete bone healing. High impact activities should be avoided in the beginning. Comminuted fracture. When a bone is broken into 2 or more pieces, it is called comminuted fracture. Such type of fracture is possible in cycle race or motorcycle race. Management of comminuted fracture. The management as well as treatment for comminuted fracture is not easy job because of many fragmented pieces of bones. Immobilization above and below the fractured area should be maintained with the help of plasters and splints. For pain management, especially in arms, fracture pain killers should be given to the affected sports person. Infection should be avoided by giving antibiotics. It may take for more than few months to restore normal condition. After that, physical therapy should be used to treat completely. Transverse fracture. It is a break of a part of bone that of a spine. It shapes like a wing. Most probably, these injuries occur in thoracic spine, the upper and middle parts of vertebra and lumbar, that are the top and lowermost region of spine and the lower back area. Management of transverse fracture. If the injury is limited to a break of transverse process with no injury, hospital care is not necessary. Medication for pain control should be given. Limit the various activities. If intricate or multiple fracture of backbone, there can be damage to spinal cord and may require operation. There can be pain and stiffness in the back for some